Lawmakers in Ghana have directed Health Minister Kwaku Agyeman Manu to appear before Parliament next week to answer questions about the 5-month closure of the renal unit at a publicly funded Korle-Bu hospital in the capital, Accra. The country's largest treatment center for patients suffering kidney disease shut down because of budgetary issues, and it was unable to pay for the everyday needs of those needing its services. According to the head of a patients group, 19 people have died since the facility was closed. Kofi Ahenkorah says the situation has left most of his members stranded because they cannot afford the treatment at private hospitals. At Korle-Bu, the treatment costs $190 per week, while private hospitals charge far more than that. I'm now being joined on the news by Lansah Musah, Deputy Editor of GHOne TV. Good afternoon, Mr. Musah. Okay, let me just proceed with my question, if you can hear me. How would you assess the impact of the closure of the renal unit at Korle-Bu Hospital on the healthcare system in Ghana?
Well, if I can get you right, the renal unit of the Korle-Bu Teaching Hospital is one of the 4 renal units we have in Ghana. Currently, we have just 4, and the rest of them, that's the public ones, we have just 4 of them in Ghana. But the Korle-Bu Teaching Hospital one is the main referral point for most persons in the country. That's where we have most of the experts, specialists in the renal sector. So the unit had to be closed down following a $4 million debt that the facility owns some of their suppliers. Korle-Bu Teaching Hospital for now does not get any subvention from government, and so they have to generate funds internally to be able to offset some of these debts that they owe. But when they try to increase the prices of the services rendered to people, the government refused, and so the facility had to close down to force the government to, as it were, accept the proposals from the facility to increase the charges. And so for now, when you go, there are 2 types of patients that go to the renal unit. There are those who are inpatient, those who are admitted at the hospital. If one of your treatment phases is for you to get renal services, you would have to, the dialysis services, you have to, you'll be taken care of. But for those who go for dialysis on the daily, on their own, when you go to the facility, you are not allowed to go there because the facility has been shut down. So there's a $4 million debt from their suppliers. And these things have come up due to the increase in cost of items on the market. If you've been monitoring development in Ghana, for some time now, port charges have gone up, and so suppliers now transfer the cost of clearing their goods from the port onto the cost they sell to the various facilities. So
I hear you, Lansah. I hear you, Lansah. But in your opinion, what steps should the government take to address the immediate healthcare needs, of the people?
For now, one of the advocacy that is going on in Ghana is for government to include renal services, especially dialysis services, onto the National Health Insurance Scheme. For now, the National Health Insurance Scheme is not catering for diseases such as renal-related diseases that requires you to go for dialysis. So governments would have to speed up the process. The last time we had a conversation with the Chief Executive Officer for the National Health Insurance Authority, he says the central government has directed that dialysis services should be included into the treatment list of the National Health Insurance Scheme. So they are working on that, and they are hoping that by 2024 they can get that. For now, that is the only way I think government can help persons with renal conditions to get services at the various renal units, because most of the people who go in for these services are people who are below the poverty line, people who are not able to afford basic health care needs. So if government adds this to the health insurance schemes, list of diseases it can take care of, then I'm sure the burden will be taken off persons who go to the renal units to look for services like dialysis. There are people who go there for like 3 times a week to get the services, and these people do not earn that much. Some of them have quit their jobs. I have a classmate of mine who had to quit his job because on a daily basis he has to go in for dialysis, and he wasn't being productive at work, and he had to quit the job to look for alternative sources of funding to be able to go in for the dialysis service.
But if I may just chip in quickly, Mr. Musah, you talked about the government. Talking about the government, how do you think they can work towards, for instance, ensuring long-term sustainability and accessibility of these specialized healthcare services like renal treatment in public hospitals?
For now, we have just 4 in Ghana, and the 4 are all centered in the nation's capital. And so, in order to cut down on the cost of even traveling far distances, some travel as far as 880 kilometers to the national capital just to seek for renal services. And so, if more of these services are opened in other regions of the country, so that people will not have to spend money traveling down here, paying so much money to get to the facility, and even the cost of that treatment is higher. So first of all, let's think of adding it to the health insurance. Second, we look at opening more renal service centers across the country, and then training of more specialists. Currently, there's a discussion on brain drain. A lot of health service workers are moving out of the country to especially the UK. Initially, it was nurses, and now we have medical doctors, specialist doctors as such, moving to countries like the UK and other places, seeking greener pastures. So if government will put in a system that will motivate these specialists to stay home, and then we train more to add to the already depleted number we have, it will go a long way to deal with not just the cost element, but also the availability of specialists to deal with that. And then we're talking about opening more centers across the country, because somebody waking up to travel 850 kilometers to the national capital just for dialysis means you're spending so much money and then productive hours just trying to get the treatment. But if it's at your doorstep at the nearest regional hospital, I'm sure to go a long way to
I'm
help.
afraid we'll have to end the conversation here. I'm afraid we'll have to wrap up the conversation here. But thank you so much, Lansah Musah, Deputy Editor, GHOne TV. Thank you so much.